Noswaith Croeso. Good evening and welcome everyone. It's my great pleasure to be able to introduce Dr. Anna Dixon to you this evening. Anna is the Chief Executive of the Centre for Aging Better, an independent charity that aims to bring about lasting changes in society so more people can enjoy later life. Anna joined the organisation in September 2015 and has taken it from startup to become an established organisation. With an endowment from the Big Lottery Fund and as part of the What Works network, Aging Better is focused on bringing about impact informed by evidence across 4 priorities: fulfilling work, healthy aging, safe and accessible housing, and connected communities. Anna has a PhD in social policy from the London School of Economics and Political Science. And prior to joining Aging Better, Anna was Director of Strategy and Chief Analyst at the Department of Health. She has also held positions as Director of Policy at the King's Fund, Lecturer in European Health Policy at the London School of Economics and Political Science, and Policy Analyst at the Department of Health Strategy Unit. Anna is author of The Age of Aging Better. It's a book that I can certainly recommend as having a very positive manifesto for our future. Anna, it's a great treat to have you to present this evening's lecture. Welcome again. Thank you very much.
Hi, good evening, and thanks very much for that warm and full introduction. It's lovely to be with you this evening. I'm sorry I can't be with you in person in Cardiff, but obviously we're all still keeping safe and following the stay-at-home advice. But let's hope that once the summer comes, we might be able to have lectures in person again. Wouldn't that be something? But for now, we're very much focused on really what it is to age in a time of COVID, and that's really what I want to speak to you about this evening. I wrote my book, The Age of Aging Better, before COVID, and it was about how do we create a society where we all age better. And I think many of the actions that I set out in that manifesto, in that book, are still really critical. If anything, we've seen some of the health inequalities accelerate, and COVID's really shone a spotlight, hasn't it, on some of the issues that we face in our ageing society. I also will be drawing on some research that the Centre for Aging Better and Ipsos Mori conducted more recently to actually understand the experience of people during the lockdown. So I'm going to bring the talk right up to date, and hopefully you'll find it thought-provoking and really happy to have time at the end for answering questions. So I'm going to share some slides with you. We are an organisation that is very much informed by evidence, data and research. So I've got lots of really interesting slides to share with you. And I hope that also you will be able to see some of the actions that we think are needed in society. So here goes. Okay, so I'm hoping that everybody can see that okay. So first of all, I think we need to focus on the positive, which is that we are living longer than ever before. So the changes in life expectancy that we've seen over the last century are truly staggering, as you can see from this slide, where a baby boy born in 1916 in England could have expected to live to just about 58, so there on the left-hand side of this graph. A baby born in 2016 can expect to see, on average, 90th birthday. Isn't that amazing? Now, this should be something that we're celebrating. Another shorthand way of thinking about this is that on average, we're going to live 10 years longer than our parents' generation or 20 years longer than our grandparents. And it's down to advances in public health, in science, in medicine, and of course, improved living standards that have caused this social revolution. And coming with it is potential benefit to society, to the economy, and to us all as individuals. But it's not only the fact that we're living longer that creates this age shift that I describe in the book. Here in the UK, it's also driven very much by birth rates, particularly the baby booms that we have seen. So, of course, after both of the world wars, there were two spikes in the birth rate. Short-lived though, and you can see that there was a much longer, albeit a lower peak, throughout the 1960s, so that between 1960 and 1969, there were over 8.3 million births here in the UK. It's really amazing. And of course, those people, well, I'll leave you to do the maths, but they're entering what we might call later life. And this is one way the demographers present population profiles, generally called population pyramids. And they show for men and women the distribution of the population by age, with the youngest at the bottom and the oldest at the top. So this first one is back in 2000. At this point, there were 9.3 million people over 65. So if you added up everybody more or less over that state pension age line, there were 9.3 million. And the black bar there is the 1960s baby boom. So I want you to keep an eye on that as I fast forward to 2019, when there were over 12 million people over 65. But as you can see, those baby boomers haven't quite made it to the state pension age. But let's fast forward 20 years to 2039. And you can see that that baby boom, they've moved into their 70s. And at this point, we estimate that there'll be over 17 million people over 65. In some ways, the pyramid, you can see, is turned into a rectangle. No longer lots more people at younger ages with a small number at older ages, but many more people living into old age. And it's not until around 2050 that we expect the 1960s baby boom to effectively go off the top of the pyramid when they die. But of course, it's not all good news, because whilst for most of the 20th century and indeed the beginning of the 21st century, we've seen these sustained increases in measures of life expectancy, there are worrying trends that these amazing increases are about to come to an end. Indeed, this was already happening before COVID, and the latest estimates suggest that COVID might have wiped another year off our life expectancy. In England, life expectancy for the women in the most deprived areas actually has started going backwards. But we also not only see differences in how long we live, but in how long we live in good health, which is what this graph shows, that women in the poorest areas of England not only expect to die younger, but live longer in poor health than those in the richest areas. Indeed, the gap is some 18 years between the poorest 10% of the population and the richest 10%. So these are really significant inequalities. So what do we mean by healthy aging? So yes, in one sense, we're talking about living longer and in good health. So there's no point living longer and living longer in poor health. We're talking about living longer and living more years in good health. But also we think about it as free from disability, because in many ways it's about our ability to live our lives. And we take the definition from the World Health Organization. And this defines healthy aging in two ways. Firstly, our intrinsic capacity, that's our sort of physical and mental health, our ability, basically how healthy we are. And obviously that's influenced by lots of things early in our life, whether we can prevent chronic conditions, things like alcohol, smoking, and so on. And then when we get to perhaps a period, and this happens for people at different ages, a decline in our health and a loss of capacity, managing those conditions to try and make sure that that decline is as slow as possible. So those things maybe can help boost, but there's likely to still be a decline. As I say, for some people that might be just a very short period before death. For others, it may be many years with living with poor health. But WHO also defines functional ability, and that's actually dependent on our environment, on our adaptations. So, for example, my intrinsic capacity to see, maybe not very good, I can't read very well. So I need to have an aid, a pair of glasses, which can mean that I can read perfectly well. That's just a little example, but obviously it could involve redesigning our homes or redesigning our streetscapes, our workplaces, to enable us to maximise our function. So those are things that can be done in our environment to boost our functional ability. So it's both. So that's why at the Centre for Ageing Better, as I'll come on to talk about in a minute, we focus on things like work and housing as well as on health. But going back to that point about the gap in healthy life expectancy, if we take that same concept of functional capacity and map that out, firstly in purple for those at the sort of richest end, we can see that they are only going to have issues with independence or needing support much later in life, perhaps not until they're in their 70s, whereas the poorer people here in yellow experience that decline much earlier. So those in the poorest part of the population are likely to experience disability in their early 50s. So as I say, at the Centre for Ageing Better, as you heard from in the introduction, we're about a society where everyone enjoys later life. And that's made up of being in good health, but also having financial security, social connections, meaning and purpose. And so we focus on the intersection between these issues because as they come together in our own lives, we're not just, it's no good being healthy if we're not got financial security. So we want all these different things to ensure that people can have a good later life. And so we focus on healthy aging, fulfilling work, safe and accessible housing and connected communities. So I mentioned at the beginning the book I wrote. Well, why did I write a book? I'm a chief executive of a charity, have not got enough work to do. Well, I realised I was in an incredibly privileged position that over the first several years of the organisation, we had gathered so much important evidence and data together that I felt it was important to share it much more widely. We want to really see some fundamental changes in our society so that we can realise this idea of the age of ageing better. But it's not an inevitability, unfortunately. It does require us to take action, hence the title, A Manifesto for Our Future. So I do encourage you, if you're interested in anything you hear this evening and want to delve a little bit deeper, to have a look at the book. It's also available in an audio if that's your preference. And of course, I am motivated by enabling more people to live their longer, healthier, happier lives. But if we look at what's said about the age shift, it's so negative. And it was really this negative view that I wanted to challenge in the book. Because you only need to open the newspaper or go online and you'll hear things about this tsunami of older people that is somehow going to overwhelm us, or associating it with a time bomb, the strain on the NHS, and increasingly about the costs to working age taxpayers, setting up these sort of intergenerational conflicts between old and young. And we've seen, haven't we, in the response to COVID, some really ageist views, and indeed that translating, at least at some points, into policy decisions. Whether that was the very initial decision to say everyone over 70 should stay at home, obviously that message changed and became sort of more sophisticated, or some of the rhetoric that came out where people were suggesting that somehow COVID was going to be a cull of older people. It's shocking, isn't it, that then that sort of language, that sort of attitude could be written about in a British newspaper in this century. So these negative views, or what I term the sort of doom mongers, are going around saying this is all terrible. The fact that more of us are living longer, that there are more people living at older ages. So in the book, I start by painting a dystopian future around 2040. And in some senses, I'm fast forwarding saying if we do nothing, well, maybe the doom mongers are going to be right. And let's have a look at some of the things that might lead to this, I suppose, dystopia of the world of aging badly. Things like the automation of jobs, perhaps leading to higher unemployment, and workers' rights being eroded, making it hard for people with disability and health conditions to remain in work. So people at older ages find it impossible to stay in work. Digital communication reduces human contact and leads to greater social isolation. Well, we've seen certainly a rise in the use of digital communication. I think for some people, it's actually been a lifeline, hasn't it, to connect us. And then what if we see companies, as we've seen a little bit happening, like Amazon, really cornering the market? So tax revenues drop, the high street basically becomes a no-go area. Things like the state pension then have to be reduced because there is not sufficient public money. And intergenerational conflict gets worse. So this sort of view, I don't think is too difficult for us to imagine. Poor quality homes, meaning that more older people are dying of heat exhaustion in the hotter summers, and there are higher rates of hospital and care home admissions. So how can we take a different path? Well, this is what I now would like to share with you, hopefully a route out of this or away from this dystopian future, and indeed maybe a way out from COVID, because as I say, some of these things have accelerated. So how can we address and get on a good road to recovery, as some people are saying, to build back better? Well, let's first of all look at how we can be in better health. COVID-19, unfortunately, has exacerbated existing health inequalities within society. So, of course, there has been a clear age relationship, but we have seen that poorer people have been twice as likely to die from COVID as richer people, and we've seen similar rates between Black and minority ethnic people in this country as well. We've obviously seen the impact of the lockdown on people's mental health, with significant deterioration. 36% of people in this is from the Ipsos Mori work, so this is people aged 50 to 70 that we were looking at in this particular study. And you can see that people who were out of work or whose physical health had also deteriorated, renters and those living alone, were more likely to say their mental health had deteriorated. But it's not only our mental health. Unfortunately, 1 in 5 people also say their physical health has deteriorated. And while some of us perhaps have been taking the opportunity to take more exercise if we're working from home, and it's really the only thing to be doing, but unfortunately that's not true for a lot of people. And obviously some people have not been accessing routine healthcare as they've needed to during this period. And also affected habits. Unfortunately, those who smoke, smoking more people saying they're eating unhealthily. There are, on the other hand, some people who are eating more healthily. So that seems to suggest that, if anything, the inequalities are potentially going to grow. Now, that's specifically about COVID, but even before COVID, we could see that lots of people were not meeting the recommended guidelines for doing aerobic exercise. So that's sort of doing heart health, keeping ourselves fit, but in particularly important at older ages is the exercise that is to do with muscle strengthening. And this is really important for preventing falls. And again, lockdown, obviously people becoming more sedentary, not just doing their sort of daily activity, everyday things like trips to the shops. This is likely to have got worse. So at the Centre for Ageing Better, we partnered up with the Chief Medical Officer's expert group to look at the evidence about which exercises help to build muscle strength and bone strength, and also help with balance. And that evidence has fed into updated UK Chief Medical Officer guidelines, which are used by health professionals when making advice. And you can see we looked at a whole range of different types of exercises and looked at the strength of the evidence for whether they help on those three different things. So some things, lots of things are good for you, and some things there's stronger evidence of quite a significant effect. So where there are 3 stars like resistance training or doing some circuit training, those things seem to be particularly good. We also looked at what was being provided locally. So unfortunately, there's fairly patchy provision of and uptake of strength and balance programs, particularly targeting older adults. And so we're keen to see this change across the country. So it's going to be really important as we build back after COVID to make sure we are addressing the reasons for these health inequalities, continuing to tackle some of those risk factors like smoking, alcohol, and particularly obesity, which has been a really strong risk factor for COVID. And part of that is going to be government regulation, but it's also very important that we help people to get more physically active. That means things like really making places walkable, encouraging cycling. And as the fitness and active leisure sector reopens in due course, it's going to be really important that they are inclusive and are attracting and providing the right sorts of facilities and classes for people of all ages to participate. So I've spent quite a lot of time talking about health. In the sort of next section, I'm going to move on to some of those things that I talked about when I defined healthy aging that really make the difference between whether we can manage in our everyday lives, even if we have some limitations to our physical or mental health. And the first of these is our homes. Well, we've spent a lot of time in our homes. I certainly have, working from home. And I think we've realised, you know, some of the things we might like to change about our home, and maybe things that don't work as well for us. If we're lucky, we've got space. If we're really lucky, we've got outdoor space. It's been particularly important to us, hasn't it, during the lockdown? But sadly, for many people, their home is actually bad for their health and can actually be dangerous. And the UK has some of the oldest housing stock in Europe, associated with some of the highest health and social care costs. So we need to do something about the state of our housing, but it's also not very accessible. So if you do develop a mobility issue, 93% of our homes don't even have basic accessibility standards which would make them visitable. In other words, they're not even homes that people could live in that have with these standards, but simply visitable. So lots to do to change both the condition of our homes and the design of the home. And we did some research. We commissioned the King's Fund to look at the impact of poorly quality homes on our health and the links to COVID. And it was very clear that COVID mortality rates were higher in local authorities that had sort of overcrowding. We see ethnic inequalities in the homes that are overcrowded. And damp and mould are particularly hazardous and also associated with conditions that have also made people more susceptible to COVID. So a really big health burden as a result of poor quality homes. And that research I mentioned with Ipsos Mori, just shows some of the challenges people have faced with both generations or 3 generations still around, caring and having adult children living with them. This is a quote from one of the participants. Interestingly enough, though, most people actually said their home met their needs and they didn't really have any problems. 60% said they didn't have problems with their home during lockdown. But we've been doing some further research and it seems that people simply don't identify the issues in their homes, or they overlook them, or don't really see how those things are going to be a problem in the future. So some of this is really about helping people to think differently about their homes and whether they're going to meet their needs for the long term. But there are some problems people have said with light and space and noise, and the people who've struggled most are those in rented accommodation, where homes just are less likely to meet decent standards. And renters are also, only 31% of them have access to a garden. The proportion of people in private rented accommodation is forecast to go up significantly in the future. So at the moment, the majority of people in later life are homeowners, but this is set to change. So in our manifesto and some of the work that we do at the Centre for Ageing Better, we're trying to campaign to get the government to bring in higher standards so that all new homes are built to be accessible and adaptable. It's also important that there are options to right size for people across all tenures and particularly at the affordable end of the housing market. And for those who want to stay put, getting easy and rapid access to aids and adaptations, and also help if you're a low-income homeowner with the costs of repairing and maintaining your home. We think there's a huge opportunity. We've heard a little bit in the news, I think, today about the sort of green retrofit of homes that's needed. Well, some of that investment, let's make sure that it not only future-proofs our homes in terms of climate emergency, but also in terms of the ageing population. The next area I want to touch on is work and finance. And in the book, there's a whole chapter on money, money, money. And some of you, I'm sure, will be like, oh, pensions. Oh, that's terribly boring. I won't be talking about pensions, don't worry. But I would advise you to probably pay more attention to your pension than you might like. Most of us are under-saving for our older age, because partly we underestimate how long we're going to live, and we certainly underestimate what we would need to save in order to maintain living standards today. In our work, we mainly focus on work in terms of if you're not in work into later life, then you are at risk of financial insecurity. Well, older age groups in general are economically active, but by the year before state pension age, more than half of people aren't working. So it's quite a significant decline in employment, and not all of that is voluntary. We've seen a really negative impact, obviously, from the economic downturn on all ages. There's been a very significant impact on younger workers, but there has also been a significant impact on older workers. And the concern that we have highlighted in our work is that older workers are much less likely to ever get back to work having been made redundant, and we see that in past recessions. So it's really important that as we the furlough is stops, that people who are being made redundant at older ages are given the right sort of support to retrain and to move sectors and to find new jobs. So from our work, we know that there are a number of challenges that older workers say they face. One is skills, and there often isn't a focus on things like, apprenticeships and adult education that's really suitable for people at those older ages. So really important that something's done to help them develop skills to be able to transition sectors. Another is that at older ages, people often want work to be flexible, either because they're juggling it with caring responsibilities, or they may have a health condition which they would benefit from some flexibility. And that's not always readily available. And many jobs are not advertised as flexible. So we would like to see all jobs advertised as flexible from day one of hire, meaning people can be confident to ask for flexibility. They also face bias in the recruitment process. We've had some work out just this week looking at the experiences of older workers in the recruitment process, and we find that there are a lot of stereotypes used to effectively discriminate against older applicants. Too experienced, don't think they'll stay around for long, those sorts of things. And then, you know, partly because of internalized ageism, because of so much negativity, people losing confidence and perhaps not having the same confidence to apply for jobs. So there is a worry for the future, those who are unemployed and not confident in finding work. It's perhaps not surprising given the current state of the labour market. And this translates through into worries about their financial prospects. So people thinking that their financial circumstances are going to get worse. And that's much more likely if you're self-employed or you've been furloughed. And just to give you a sense of scale, work we commissioned from the Learning and Work Institute suggested that 1 in 4 older workers were on furlough. So that's 2.5 million people. And just to give a sense of the difference between the return to work rates that I talked about, it's just 1 in 3 amongst those over 50 compared to 2 in 3 for those between 25 and 34 years old. So this is why we're calling on the government to invest in tailored support, employment support for over 50s. And this is research by the Institute for Fiscal Studies, showing that older workers, as a result of COVID, are adjusting their plans, some realising they're going to have to work longer, and often that's because pension values have decreased, or actually positively because they've worked from home and that got the flexibility that perhaps was otherwise not available to them. And then there are some who are planning to retire earlier. That does tend to be those who are wealthier, but worryingly, there are also people amongst that group who are furloughed and maybe are just seeing this as, I'm not going to get back to work, and so effectively retiring early. And the worry is that they don't have the financial savings in place to enable them to live securely. And this was from the Mori work, people thinking about changing their work pattern, obviously very common. There were as many as 32% of people 50 to 70 thinking about early retirement, and 1 in 4 a career change. So what are we doing at the Centre for Ageing Better to enable more people to stay in fulfilling work? Well, we've pulled together 5 actions that we want all employers to commit to take, which will enable more people to stay in work longer. And it's great to see that there's been such a one of the positives. I think we need to take the positives out of COVID about being flexible, hiring age positively, getting rid of that age bias in the recruitment process, supporting people with health conditions and caring responsibilities, making sure people do have access to that career development and training at all ages, but also making sure that there's an age inclusive culture in the workplace. So finally, before I finish, I just want to touch on communities, because I think this is perhaps, if anything, you know, one of the silver linings for many of us has been that we've spent more time in our communities, and actually communities have really come together to help one another out. And many people in this age group are active in their communities, whether that's formally or informally. And this was the case before COVID. We see that over 65s were more likely than any other group to regularly volunteer. And we've seen people in their 50s and 60s actually volunteering for the first time and wanting to continue to volunteer after COVID. So that's all really positive, and hopefully many of those people will carry on actively participating in their communities, building those social connections with people around them and feeling connected. And we have seen across the board, actually, that lockdown has increased levels of connection in communities, in particular for people at older ages. And they felt people had people to count on if they were ill or unable to leave home. There was more saying hello to people in their local areas. So we had a number of measures here that we used to gauge this idea of connection with our neighbourhood. But I'm afraid this is, you know, again, not something we've experienced equally. So if you are comfortably off, you're more likely to have seen this sort of increase in feeling that you were connected to your community. And if you were struggling financially, much less likely. So it does seem that depending on the place that you live, we've experienced our communities differently. And there definitely seems to be some association between social exclusion and poverty that I think we need to understand. And certainly if the government is serious about its levelling up agenda, it needs to be investing in communities, not only in the physical infrastructure, but also in the social infrastructure. So as I come to the end, how can we avoid that dystopia that I described at the beginning and create the world of aging better? A world where technology is used positively, enabling older workers to do physical jobs, where people have access perhaps to lifelong learning accounts and access to that sort of retraining that we talked about to keep skills updated. People are in much better health, they're working longer, paying taxes, and those who can't work are supported to volunteer. Digital connection means people are moving to rural areas, they're repopulating, and autonomous vehicles mean that people without transport or who are unable to drive for different reasons can get about and stay connected. And prevention means that we've tackled things like obesity, we've got lifetime and carbon neutral homes, so there's lots of options for people to right size, and people are again shopping locally and staying local, and we have thriving high streets where people of all ages can meet. Wouldn't that be wonderful? Well, let's hope that it's not a utopian dream and that we can take action as I set out in my book. It is important, though, that we first of all just wake up to the reality of our ageing society. Too many people are in denial. I hope that I've woken you up, that perhaps you've been surprised by a few of the figures, by the size of the age shift. But we also need to stop the negative thinking. We need to tackle those doom mongers head on. And it's going to require urgent action. It's not all government. It's going to require private, community sector, employers, industry leaders, innovators, investors. It's going to require every one of us to do something different, to play our role in creating this age of aging better. So I hope that you've enjoyed some of those thoughts that I've shared with you this evening, and I really look forward to answering some of your questions. Thank you.
Anna, thanks for that thought-provoking and upbeat presentation. I'm sure it's provoked a lot of questions from our participants this evening. Perhaps whilst we're waiting for some of those questions to start coming in, and I could just pick up on one of the aspects of your book, which related to loneliness. And I was just wondering how you think that we can allow people to remain in their own homes, but without becoming isolated and lonely. Any thoughts on that?
Yes, well, you know, in my book, you'll have seen I called it the loneliness myth. And I think a lot of people have been like, well, you know, how can you possibly have written that? And now even more so with COVID. But the myth that I'm talking about in the book is this assumption that, firstly, it's only older people that are lonely. We've seen that actually loneliness is affecting people of all ages, and that all older people are lonely. And again, it's not the case. You know, many older people are very well socially connected and active in their communities and don't feel lonely. There's very high levels of satisfaction. But of course, as I showed, COVID and lockdown have had a massive impact on people's mental health and on people feeling socially isolated and lonely. And I think it's really critical that we look at sort of who those people are and why that is. I think that we've always known there's been digital exclusion, and that at older ages you see more people who never use the internet. And whilst this has been a great stimulus to get a lot of people online who perhaps never quite saw the point of it and were a bit too afraid of it, or couldn't quite afford it, or wouldn't justify the cost, all sorts of barriers that we knew existed. There's been a real push to help people overcome those. And those who have obviously, it's been a lifeline because it's enabled us to all stay connected to family, friends, groups, book groups, wine groups, whatever it is you're interested in, playing bridge. You could do it and carry on doing it and having that social contact. But let's remember that there are still, despite this, quite a lot of people who are not digitally connected. And if anything, they've become more isolated because they're missing out even more than before. And my worry is that as things sort of get back to normal, that lots of things will not go back, as it were, offline, that businesses and others, you know, the shops that have shut are not going to reopen. These online businesses, that is the way, online shopping, seeing your GP, so many things will not go back. And so we really must now, I think, have a redoubled effort to really support people who are not online to get online, but also preserve some of the channels, whether it's telephone, other basic technology, just to make sure that people are not disconnected.
Yeah. So just following up on that then, Anna, what is your vision for the high street? You say, you know, it's going to be potentially harder for older folks to interact on the high street. How can we transform our high streets, do you think?
Well, obviously, you know, this has become, you know, much more challenging as we've seen so many businesses likely to not reopen. And I think it does need us to sort of rethink the spaces, possibly think about some conversion to housing, but we need to make sure that the quality of that housing is high enough, that it is the right sort of housing, bringing people to live in those spaces. I think we need to convert some of it to community use. So again, you know, as I was saying before, we've seen in some areas a real coming together of community, but that's because they've got some basic infrastructure in those places. If you know, I visited poorer community in Leeds and everything's shut. You know, there's no post office, there's no library, there's, you know, one GP practice and thankfully a community centre, because Leeds City Council have for the last 15 years funded Leeds neighbourhood networks with infrastructure funding, and so they've been able to maintain a community facility. Without that, there would be nowhere to meet, there would be nowhere to come together. So we need to be rethinking, you know, some of those spaces for community use. And then obviously we've got to hope the economy is going to come back. Small and medium-sized enterprises, entrepreneurs, older and younger entrepreneurs coming together, you know, small business units. So I think we have to just think very differently, but the world of sort of retail and the high street as it was, I really think is gone. And so we do need a reimagining of the high street.
Thanks, Anna. So just time to pick up on some of the questions coming in. And again, to follow up on one of your comments, someone's asked, what are the solutions to digital deprivation?
Well, I think we're now at a point where we almost need to treat digital as is it fourth utility? I think that's right. And, you know, the same protections that are there in a way for vulnerable customers, if it's gas or electric, we need to be thinking about how do we bring more universal access to the internet. We know that motivation and skills was an issue, but that also just the cost of data and access to refurbished tablets. So there's been some great local partnerships between some of the age-friendly communities in our network and businesses donating refurbished computers. So I think it's going to take a lot of different things to come together to really push on and make a big difference.
Thanks, Anna. Do you think intergenerational living has more positive impacts on the well-being and lives of the elderly as opposed to the generations living separately?
Well, I'm a great advocate for mixed age communities, and I think there are huge benefits for mixed intergenerational communities. That doesn't necessarily mean multi-generational households, but I think for some people, even sort of multi-generational living in a single household is also something that is potentially quite attractive, and many people, partly forced through circumstances during COVID, have found themselves having perhaps elderly family members living with them. But we have to then design our homes for that purpose, rather than it being a situation where there's overcrowding or there's multi-generational households that's sort of the living conditions are not right. Because we've also seen, I think, in some communities that intergenerational, multi-generational living has been a cause of COVID transmission, because elderly people couldn't sort of necessarily keep themselves separate from younger working people who were exposed every day to risk. So we have to build for it, build differently. But yes, I think there will be some people who may have a preference for a retirement community, only living with people of their own age. But certainly there's evidence to suggest that we have a better outlook. We understand one another better if we mix across generations. So I think there's a lot to be said for intergenerational living, yes.
What do you think the government should do to prevent chronic disease so that people can live longer and healthier lives? Could any preventative measures that are put in place reduce the pressure put upon the NHS?
So I think there is further to go on obesity, and we know that ultimately that comes down to some of the food reformulation, taking sugar out of food. We've seen some progress on that with the sugar tax and reformulation by drinks, sort of fizzy drink companies. So I think there is definitely room for more in terms of government regulation. In terms of smoking, questions about being very radical now that we have substitutes like e-cigarettes. Do we just go for a total ban on tobacco? So just, I think there's definitely further to go. If we really want to drive prevention, those are still the major causes of ill health and premature aging. So we do have to really focus on those major risk factors. And we know from evidence that regulation is the most effective thing, rather than trying to do behaviour change on an individual basis.
Thanks, Anne. Lots of organisations, politicians talk about the links between health and housing, but how do we get policy action to tackle poor health directly relating to housing conditions, from respiratory illnesses in damp, cold homes to falls in unsuitable homes, if these funding streams remain siloed?
Absolutely. Well, we launched the Good Home Inquiry, so I'd really encourage you and the person who asked the question to go to our website and find out more about the Good Home Inquiry, because they are actually looking to come up with some recommendations and solutions that are going to exactly address this issue. So yes, there are lots of issues about the funding, about the eligibility, about actually getting the right services in to your home to make those changes. So that's all being looked at, and I think they will hopefully come up with some really radical solutions to address that very issue.
Mm-hmm. Thanks again, Anna. Is the government prepared financially to support social health and psychological needs of the population in the future?
I don't know. I think there's been certainly a huge recognition of the prevalence of mental health. It's obviously something that was already high on the agenda of employers and of government even before COVID. But I think that the sort of, the importance of mental health services perhaps hasn't translated yet into the right sort of investment in the health service, where we still see, unfortunately, mental health services perhaps not getting their fair share of resources. I wish I had the power to do something about that, but I don't. But we need to keep making the case for why investment is so important. And again, at all ages, obviously children and young people's mental health, there's some terrible statistics around that. But we know that mental health is really underdiagnosed at older ages, and where it is diagnosed, depression and anxiety, it's much less likely to lead to a referral for therapy. So there's a lot to do to educate health professionals to make sure that older patients are actually getting the mental health support, that diagnosis and treatment that they need.
Thank you, Anna. What thoughts do you have on the reform of social care, long promised by the government?
Well, I just had the privilege actually of serving on an advisory group to the Scottish Government. They set up an independent review on adult social care, which is just reported. So some of my views were reflected in that report. And I do think that England really could do well to look north of the border. Scotland have made great strides towards integration of health and social care, probably quite a few years ahead of where we are in England. I'm not sure in terms of Wales, I think as well, probably further in terms of that integration in terms of health and social care. But it was really clear, even in Scotland, that many people were not getting the care and support services that they needed to live a full life. You know, people do have a right to be able to live, play and work, and they're just not getting even, the basic care. And there's almost a view that, well, if you get taken to the toilet and you get dressed and sat in a chair, that somehow that's enough. I think particularly at older ages, the expectation of what care and support there is too low. So we clearly need to have reform here in England. It's well overdue. It can't just be limited to funding the current system. I think the current system is broken. It needs to be a radical reform and thinking very differently about the care and support that we want in the future.
Thanks, Anna. I think someone's been a devil's advocate here, but I'm sure you'd like to pick up on this, Anna. To benefit the community from an employment point of view, is it better to have a 64-year-old in work or a 20-year-old?
Oh, that age-old question. So yes, this is one of the classic myths that, if you have more older workers working, it's going to take away jobs from younger people. And thankfully, when the evidence has been looked at, there's no evidence of that. So as more jobs are created, actually it creates, you get more older workers, you get more younger people in work as well. In terms of good or bad, I really don't want to pit the generations against one another. All the evidence says that a diverse team, an age diverse team, actually produces better results. So what you want to be aiming for is a diverse, age diverse workforce. So make sure you've got people of all ages in your teams.
Great. With the impact the pandemic has had on our economy, what would be realistic in terms of time and financing to build this society where we can have better quality of life in our older age?
Gosh, You've got some good questions coming in here, haven't you? You're really keeping me on my toes. Well, I mean, well, we're in trouble, aren't we? The economy's taken such a hit, and the economists are also predicting a long-term impact on GDP as a result of Brexit. So, there's not going to be much in the Treasury coffers for a while. The OBR, the Office for Budget Responsibility, has always put in its projections the ageing population as an issue. It's often overstated how much it contributes to things like health and social care increases. They're actually relatively modest increases, just purely as a result of demography. It's often things like technology or other things which are really driving the rise in expenditure. So, of course, it's very difficult to say, how are we going to afford this? I think my book is really about saying this is why we've got to act, because we've got to prevent. If we just carry on as we are, then yes, it looks pretty unaffordable. If we have the same level of ill health, if we have the same need for social care, if our homes are still as poor condition as they are now. And really it's saying, we've got to make the change now to sort of make it more affordable in the future. So I hope that argument sort of makes sense to you and to the person who asked the question. Yeah, I'm generally an optimist, as you've probably gathered from the talk tonight. But it's hard, isn't it, to think that anything other than that we're going to be economically, things are going to be very challenging for quite some time yet.
I guess related to that then, Anna, how do we incentivize private interests into making their jobs more flexible and accessible?
Yeah, well, we were already trying to promote flexibility because we, from our research, were clear that this would make a big difference to older workers. And it was about different sorts of flexibility. So some of it was, the opportunity perhaps to work from home, but also flexible hours. And I think it's really important that businesses do make it clear that people can ask for flexibility, that they need to enable their line managers to be confident about the sorts of flexibility that different roles that's possible. A lot of older workers don't know they can ask for flexibility, and I think it's just really important to open up those conversations with people. And clearly for sort of more office type workers, obviously COVID has accelerated a massive shift in flexibility. And the question is going to be how much of that continues to be offered, and how much companies are back to saying they want people in offices. And I think that we're hearing in the news at the moment that different companies are taking quite a different attitude to that. But I just say to any business, if you want to, retain people and have that sort of diversity of skill and experience, then offering flexibility, it's something that lots of people of all ages want, but it makes a real difference to older workers.
Great. Thanks again. I think we've got time for one more question, maybe. Do you think that race has a big impact on this subject?
Well, the intersectionality between race and ageing is a real concern. And in fact, there's been just not enough research done into inequalities by race and age. And partly, we're seeing now, obviously the older population is becoming more diverse. So the sort of the ethnic diversity of the older population is changing very rapidly. And so we do need to do more to understand the experiences of people from different backgrounds, different ethnic and backgrounds. We've published some analysis that makes very clear that there are significant inequalities. That's true in terms of housing condition, financial security, health, particularly in this cohort of people 50 to 70. So again, some of that research is on our website, and we hope to be doing more to understand that race and age inequality.
Thanks again, Anna. Someone's asking, they're wanting to find a bit more, look a bit more into more depth about the topic this evening. Should we direct them towards the Centre for Aging Better web pages, Anna, as a start?
Yes, absolutely. Please do look at the Aging Better website, www.aging-better.org.uk. You can see enormous amount of our work. We have lots of great video case studies talking to people, and lots of information about our work and the work of age-friendly communities. Obviously in Wales, you've got a new ageing strategy, you've got Older People's Commissioner, and so, you know, we've got things that we would love to learn as well from Wales, but hopefully some of the material that we produce, our focus is mainly on England, but we're really keen to share that and have it as widely applied by people across the UK. So do take a look at the website.
Great.
And of course, I'd probably just give it a final plug, you know, do buy and have a read of the book. It's all in there.
Totally concur with that. Anna, thanks so much again for those fantastic insights this evening. I, for one, would certainly take your utopian view for 2040 over that dystopian perspective. So let's hope that comes true for us all. Thanks once again, Anna. I know my colleague Karen Edwards, I think, would just like to capture some feedback from our audience this evening. But thanks again, Anna. Much appreciate.
Thanks for having me. Been great.
Take care now. Bye.
Bye.
Over to you, Karen.
Great, thanks everyone. Yeah, just before you disappear, for those of you who've joined us before will know the drill by now. If you can go to menti.com on your device or phone, use the code 3267775, and we'll just run through a few questions here. Oh, sorry. Am I? Oh, great. Sorry, I've got a feeling I'm not sharing my screen here, am I? Great, right. Sorry about that, everyone. Okay. So, a couple of people have started to answer our questions this evening. Okay. Just give people time to catch up if you're able to join. Great. Okay. Lovely. Okay, move on quickly to the next question. So, have you attended a public lecture before? And we've got a few regulars and a few new members of the audience tonight, which is good to see. And if you can let us know where you found out about this evening's lecture. So lots of people being recommended by teachers, colleagues. That's great. Thank you. So yes, why did you attend the lecture this evening? If you can select your top 2 reasons. A lot of you wanting to be informed, and I'm sure you have been. Great. And a few of you were hoping to be inspired, and again, we certainly hope you have been. Thank you. Okay, so as a result of viewing the lecture this evening, Perhaps you could let us know whether a lot of you are saying that your knowledge of the subject matter has improved, or you'd like to find out a bit more or undertake further research. So that's good to know. Thank you. And then finally, how would you describe this evening's lecture in 3 words? Great. A lot of thought-provoking, interesting, informative, well delivered, inspiring, relevant. Great. That's really good to know that you've enjoyed this evening. Okay, thank you very much for that, and I'll hand you back over to James Matthews.
Thanks, Karen, and thanks again to Anna. It just remains for me to thank you all for attending this evening, and to let you know that the final talk in this year's program will be given on the 11th of March by Professor Claudia Hammond, who is going to be talking about the importance of rest. So that's Thursday, the 11th of March. Diolch yn fawr iawn. Stay safe, everyone, and nos da. Good night.